Hey, what's up everyone? Welcome to Careers Out There. I'm your host Mark Luber, and we are helping you find a career that fits you. Our guest is Dr. Jeff Garland, who has offices in Grayslake, Illinois and Highland Park, Illinois. What you're watching is a short version of the interview with Dr. Garland. To learn more about being an internist, you can see the full interview at careersoutthere.com. All right, let's meet Dr. Jeff. I think most of us know what a doctor does. We all go to the doctor. We've been going to the doctor our whole lives. At least you all should be. So, what we don't know is a typical day. Walk us through a typical day for an internist.
Well, first of all, an internist is an adult doctor, a physician for people over 18 years old. Typical day, it's kind of like a triathlon. The first part is, like the swim, is going to the hospital. So you go to the hospital, some doctors go to one hospital, some go to two, and you see your patients, and you reassess how they're doing. Can they go home? Do they need a new test or a new antibiotic? How are they doing? So you evaluate them, you listen to their symptoms, you review the data, and then you make decisions. After that, then you get to converse with other physicians. Then after that, you go to your office. That's the second leg, kind of like the run.
Okay.
Or the bike. I don't really run triathlons, so I don't really know how it goes. So we'll call it the bike. So that part is, patients come to your office with their medical problems. A lot of them have blood pressure, cholesterol, diabetes, back pain, sinus infection, come for their physical, and you listen to their problems and you try to put them on the right medications. And some of them just need someone to listen to. Other people need treatments. And you do that during the day. There's a lot of interruptions, the hospital calling, the pharmacy calling, other doctors calling. And then after that, the run, you review all your paperwork, which could be lab results, CAT scan results, mammogram results, x-rays, and a lot of them you have to call the patients, you need to get another test, or your test is okay, and then you can go home, and hopefully you won't have to go back.
Right. What's the most rewarding part of it all? The most fun part and the most rewarding part?
I mean, I think the most rewarding part probably is being able to get involved with people's lives, that you are a part of, hundreds, perhaps thousands of people's lives, where you know them, you know about their family, about good things that happen to them and bad things that happen to them. I think I chose to do a private practice. It just kind of happened. I interviewed at a bunch of places. I think in a private practice setting, you might work harder, more call, but more rewarding. That you actually get to decide what your hours are, or when it's time to hire a doctor, you kind of get to pick. Or if you work at a big hospital system, they tell you when you're going to work and who your receptionist is going to be and who your lab tech is going to be and who your next partner is going to be. So you definitely lose a lot of say as far as how things are going to go. I think it's more rewarding to be in a situation where you have more control. If you work in a big group, they could fire you. You don't know what's going to happen. But there's less that you have to worry about in some ways. You might not be able to do as well financially the first couple of years, but after a while, you usually do better in a private setting.
And now if I'm watching out there, I'm interested, I'm not yet in med school. What are some keys to success? Give everyone some keys to success in being an internist so that they could kind of have some guideposts to go by.
I think you have to take the science courses and see if you can do well in them. Not everyone can. A lot of people can, but not everyone, so take the courses. Getting through the process is like a long journey, and it seems like it's never going to end. Test after test, finals after finals, the MCAT, boards and other boards. But eventually, one day, you're done. Along the way, there could be a setback. You could get a C in a course. Things might not always go your way. You might have to take the MCAT a second time. But if you're determined, you can get through it. And then to be successful, a lot has to do, do you have the right personality? Do you like people? Do you like talking to people? Sometimes you're the therapist for a lot of patients. A lot of people don't see a psychiatrist or psychologist. They just are too busy, they don't want to, the stigma. So a lot of people use you as that person who they want to talk to. And some people really enjoy that. I do. You get to hear a lot of stuff. You're almost like the hairdresser. They get to hear all the good stuff. Or so if you like hearing about people's lives, if if you enjoy people, if you enjoy, sometimes a little bit of advice can help them more than anything. So if you enjoy talking to people and socializing, it's definitely a good job for you. A lot of people have jobs where they're just at a desk all day. So this is great. You get to talk to people.
Hey everyone, if you want to learn more about being an internist, be sure to watch the full interview at careersouththere.com, where we help you find a career that fits you. Thanks again for watching. I'm Mark Luber, and we look forward to seeing you there.